Hello, everyone. I'm Sophie Alexander of the Nutritional Wellness Center, and welcome to my talk about balancing female hormones. I have been a nutrition response testing practitioner for about 10 years now and came to it very much because of my own health and my own story. Today, because we're talking about hormones, I'll focus more on the hormone aspect of my story. I went into puberty at what I consider a younger age, age 11, and dealt with just terrible menstrual cramps. I remember missing school. I remember taking just really big horse pill Motrins, just trying to manage it. And so it definitely, probably age 16, I ended up going on birth control. And a lot of that was to manage the symptoms. And that definitely, it artificially normalized my period and handled the menstrual cramps. And then as I became more educated about natural health in my early 20s, I was like, I don't want to be on hormones all the time. I want to see what my body is doing on its own. So I went off of birth control probably in my mid 20s. And after, so I had been on it for 10 years by then. And, the menstrual cramps were still there and things like that. And so that's really part of what got me, along with chronic Lyme and digestive issues, got me to the Nutritional Wellness Center as a client back in 2009. And a lot of my issues, especially with Lyme, took a long time to clear up. But the menstrual cramps were one of the things I had my biggest wins with. I'd been a client for like 3 months and really changed around my diet and started customized supplementation. And the menstrual cramps, like, they were gone. Haven't been back since. And now, this many years older and 3 children later, I'm on the other spectrum of optimizing my hormones. And so I just feel like I have a full gamut of that perspective to share with you today, and to really help you become empowered about your own health and your own hormonal balance. Because for so many women, hormones are driving them crazy. And we laugh about it, but it's not cool, and we don't have to live this way. In my experience, there are so many reasons someone may be experiencing hormonal imbalances. And what I've really discovered with my work and find clinically every day is that anything can cause anything. And really what we need to find out is what is going on with you, especially if you're suffering. So before I go more into solutions and handlings, I'm just going to lay out some foundational stuff, because I have found, and this was true to myself too, that women have so little idea what's going on in their bodies in terms of their hormones and how it all actually works. And it can feel complicated and overwhelming, but at the same time, we can break it down. So very basically, what are hormones, right? Hormones are chemicals secreted by the glands throughout the body and are responsible for many essential functions. Their job is to send messages through the bloodstream to the tissues and organs, telling them what to do and when to do it. This makes them essential for regulating most major bodily processes, which means that there are many bodily processes that can be affected by an imbalance. And there are some hormones that are really important in the female body. Estrogen is a crucial hormone for women because it's responsible for our menstruation, for menopause changes, reproduction, our sex drive, and even our bone and our blood health. And progesterone is the primary hormone in a class of hormones called progestrogens. And these are sex hormones that impact our sexual development during puberty and are involved in healthy reproduction. So estrogen is talked about a lot. It is made by the ovaries, our fat cells, our liver, and our adrenals. And a variety of tissues in our body express estrogen receptors, including our intestines, our brain, our bones, and our fat tissue. So estrogen is what is needed to keep us curvy, maintain healthy mood, and our fertility. But if it's dominant, it poses a problem for both men and women. And most commonly, it's elevated due to either too much production or I see in practice, lack of detoxification of the liver. And I'll be talking about that a lot more. So low estrogen in women is most common during menopausal changes and those perimenopausal changes. But it can be caused by hysterectomies, radiation, chemotherapy treatments, or certain conditions like anorexia, genetic diseases, low body fat, and thyroid problems. Some common symptoms with those with estrogen deficiency are hot flashes, night sweats, anxiety, mood swings, depression, memory problems, dry skin, painful intercourse, and loss of libido. Estrogen dominance is what I see more of in practice. Estrogen is the dominant hormone in the first half of your menstrual cycle until you ovulate, when you're having regular cycles, right? And after ovulation, progesterone is supposed to raise and estrogen is supposed to fall. And then progesterone decreases and menstruation occurs. So the ratio of these two hormones is critical. And when you hear estrogen dominance, you could have too much estrogen. Well, you do have too much estrogen relative to your progesterone, but it could mean that you have normal estrogen and too little progesterone, or it could mean that you have too much estrogen. And that's part of the troubleshooting, what we have to figure out what's going on for each woman. But either way, the imbalance creates the same problems. So it's said that really 50% of women over 35 are estrogen dominant, right, for women. And endometriosis impacts around 10% of all women, and this is growing. And for those dealing with infertility, it's been shown that up to 50% of those have endometriosis. And around 75% of reproductive age women have mild PMS symptoms, and 20 to 30% of women have clinically significant PMS symptoms. So there's a lot of hormone dysregulation going on for the modern woman. A lot of women looking for answers about how to address it. So if, you might identify with this if you're dealing with some estrogen dominance. You tend to have more premenstrual mood changes, deal with painful or lumpy breasts, different parts of your cycle, can't sleep, especially certain parts of your cycle, get premenstrual headaches and migraines, deal with anxiety, infertility, recurrent miscarriage, and unexplained weight gain. So managing estrogen dominance, so much of it comes down to supporting your liver. The liver metabolizes estrogen appropriately and efficiently, but to help it do that, we need to take care of it. So avoiding toxins, and I will speak a lot more about that shortly. But then also avoiding alcohol can help. So many women tell me that alcohol poorly affects their sleep, poorly affects hot flashes if they're starting to have premenopausal changes. It bogs down the liver, and if you already have a liver that is tired and is struggling, then it makes things worse. Managing stress levels is a huge thing with balancing estrogen because it helps to balance your cortisol levels. And I'll talk a bit more too, just about how much cortisol can throw off the balance of these hormones. Managing your insulin level also then impacts your cortisol level, impacts your hormone balance. And that's by, you can control that by having a diet that's low in sugar. And avoiding chemical estrogens, right? So I'll be talking more and more throughout this about all these forever chemicals that impact our hormone balance. And part of the reason that there's such an epidemic of estrogen dominance is because of the amount of plastics that are used. So at least avoiding BPA, plastics that say they're BPA free, but ideally you're switching to glass, you're switching to stainless steel, you're storing food in glass, you're not reheating food in the microwave in plastic. Another big source of these chemical estrogens are from your personal care products. So your makeup, your shampoo, your conditioner, your body wash, all of that, your deodorants. I'm a big fan of the Environmental Working Group and their Skin Deep database, where you can look up personal care products that you use and see them rated. And you want to use products that are rated at a 1 or 2 to know that they do not contain these chemical estrogens. And eating organic makes a huge difference too in terms of your glyphosate exposure, which is Roundup, which is a major chemical that impacts hormone imbalances. And the Environmental Working Group has a great resource called the Clean 15 versus the Dirty Dozen, which the Clean 15 are the foods that are grown with the least pesticide usage, and you know that you're okay buying conventional produce on that list. And then the Dirty Dozen are the ones that are most highly sprayed, that you want to prioritize buying organic. There are certain foods that help build estrogen. So they are great to eat at the first part of your cycle, right? That's flax seeds and sesame seeds, hummus, garlic, berries, and cruciferous vegetables. The cruciferous vegetables are so helpful for the liver in terms of clearing out estrogen metabolites as well. And now let's talk a bit more about progesterone, right? So progesterone helps prepare the uterus for implantation of a fertilized egg. It helps maintain the pregnancy. It regulates blood pressure. It improves mood and sleep, supports early pregnancy and continued pregnancy. Yep. Helps develop mammary glands during pregnancy. It decreases uterine contraction to prevent contractions during pregnancy. And it decreases activity in intestines, which sometimes is why people deal with some constipation during certain parts of their cycle or during pregnancy. So low progesterone in women can cause irregular or absent menstrual cycles, mood changes, particularly anxiety and depression. Also can cause hot flashes, just like estrogen too, but night sweats, vaginal dryness, and headaches or migraines in women who aren't pregnant. And it's just a huge part of spotting in miscarriages with pregnancy when it's not high enough. So managing progesterone, getting enough vitamin B and vitamin C are really necessary for maintaining progesterone levels. Getting enough zinc makes a big difference with progesterone as well. So shellfish is a good source of zinc, but also red meat, it's a great source of zinc, as is poultry. And again, the whole theme with stress levels, right? Because cortisol trumps all, and cortisol, your body will prioritize making cortisol over progesterone if you're in a chronically stressed state. And so it is just managing cholesterol, managing the chronic stress response is such a key part of making sure that you have enough progesterone. I wanted to share the resource of Dr. Mindy Pelz because her work inspires my work, and I used a lot of her information with this talk today. She's a chiropractor. Her passion is educating women about balancing their hormones, using holistic methods, particularly intermittent fasting. And I'll speak a little bit more about that. She's got great information. She's really easy, straightforward to understand on her YouTube channel and her podcast. And she has this wonderful book that I recommend every woman read, not whether or not they're perimenopausal, menopausal, but it just helps you to understand if you're younger, what your body will go through and how to set it up for success, right? She's, so the Menopause Reset is a great resource. And you just learn so much about your hormones, how to balance them, how to support and address if you're having menopause related symptoms. And she really walks you through intermittent fasting and how to introduce that to your life. Intermittent fasting is where you start going more periods without food. You know, it could mean for you just stopping snacking and eating 3 meals a day. For other women, it means an earlier dinner or a more delayed breakfast. So you have a longer fasting period overnight. But then she takes you into even longer fasts that can be so helpful for different health conditions and particularly for menopausal women. And it's all just really straightforward and easy to understand. And so the reason I wanted to talk about her here is she really talks specifically in her book about using fasting to support progesterone. And intermittent fasting is just becoming more and more popular. But it's not being talked a lot about, except for Dr. Mindy and some other women, about how specifically it needs to be done for women. And so as we approach midlife, progesterone begins to decline. So women over 40 or others going through their menopause years will experience an up and down roller coaster and decline in progesterone, right, as you move through those years. And if you're not menopausal or perimenopausal, progesterone can also get out of balance if you're just fasting too intensively, right? If you're someone who has seen such benefits from intermittent fasting for cognitive, like increased energy and mental clarity and weight loss and things like that. But if you're doing it all the time and you're not menopausal and postmenopausal and you're still cycling, you can throw off your progesterone by fasting too much. So it's really best to do the longer fasts and push fasting during your estrogen time, which is days 1 through 17 of your cycle. And being gentler the second part of your cycle. And if you're having low progesterone, you can experience your hot flashes, migraine headaches, spotting during your cycle, feeling anxious, agitated, and dealing with fibroids or endometriosis. So a lot of women, they're doing a lower carbohydrate lifestyle because they see that it benefit weight management or benefit their health. And it really does help manage estrogen. But when we're in the more progesterone component of our cycle, which is the second part of our cycle after ovulation, we really want to be having some foods that are a little bit more high carbohydrate because they help build progesterone. So that's some of your starchier vegetables like your pumpkin, more carbohydrate from beans and other squashes, tropical and citrus fruits. We also see on this list nuts and seeds, those cruciferous vegetables again, they are so wonderful for hormone health. So that's broccoli, cauliflower, Brussels sprouts, and grass-fed meat also helps build progesterone. Now we'll talk a bit about testosterone. It's made in the ovaries and in our adrenal glands, and it plays a role in our sex drive, helps with the production of hormones during our menstrual cycle. All women need some testosterone. And when it's too low, have decreased sex drive, it's a factor in infertility, and you can have irregular absence of menstrual periods as well. Low testosterone can be caused by long-term oral contraceptive use. Of course, as we get older, it declines, or if you've had to have surgery where the ovaries are removed. And so cholesterol plays such a role for women with sex hormone production. And I wanted to speak about this just because cholesterol gets vilified so much. But only about 20% of the cholesterol in your bloodstream comes from your food, right? Our body makes it, and our body makes it because we need it to synthesize and utilize vitamin D and our hormones, right? Particularly, testosterone and estrogen. So I wanted to share this chart, not to overwhelm, but just for you to see that at the top of the chart is cholesterol. And it's from there downward that all the rest of our hormones get made, right? So it's the precursor for progesterone, it's the precursor for estrogens, it's a precursor for testosterone. So without a healthy amount of cholesterol in our body, and so if you're eating a cholesterol low diet to try and manage cholesterol, you're only impacting 20% of what your body's going to be actually making, but you are not giving your body the building blocks that it needs for optimal hormone production. All right, let's talk a little bit more about hormone disruptors, right? Because I mentioned this earlier, but I wanted to go into more detail in case it's a new information to you. Endocrine disruptors is another word for it. There are harmful substances found in our food or water and everyday products. They disrupt our hormone, creating all these side effects that we've been talking about. And they're just tricky, and they play all sorts of tricks on the body. They can increase the production of certain hormones. They can decrease the production of others. They can imitate hormones in our bodies. They can turn one hormone into another. They can interfere with hormone signaling. They can tell certain cells to die prematurely. They can compete for essential nutrients. They can bind up important hormones that our bodies need, and they can accumulate in organs that produce hormones, thus disrupting that production. So all in all, wreak havoc. And I see in my practice a major, major underlying reason why women are dealing with hormone imbalance. So some of the common disruptors are the plastics I was already talking about, BPA, dioxins, which are another kind of plastics that are often, another kind of chemical, found in water. The phthalates are so common in personal care products. Fire retardants are in clothing and in furniture. Lead, arsenic, mercuries in the food supply and the water supply. There's so many of them. Unfortunately, we are exposed to over 80,000 chemicals on just daily, regular life in the United States. And there's so much that you can do in terms of lifestyle practices to avoid it, but you have to be very proactive about it. So here's another big list of things that I see with clinically that cause hormone imbalance. Poor diet and nutrition, particularly overconsumption of sugar. So blood sugar is all dysregulated, and consumption of what I call toxic fats or poor quality fats, which are the most fats used in processed foods and in restaurants, and cause a lot of dysregulation with the liver and disruption of hormone balance. Being overweight, having poor liver detoxification, which we spoke a lot about already. Gut dysbiosis, which we're going to talk about more, but that's the balance of your microbiome. Dealing with constipation. So if you're dealing with constipation, we know that toxins are not clearing out of your body properly. We know that you're dealing with poor bile flow from your liver, which impacts your digestion and helps the body clear out excess hormones. You got to be pooping properly to have a good hormone balance. Chronic stress and inflammation, as we talked about how much that impacts our hormone production. You can have other stealth infections that drive up inflammation, like chronic Lyme could play a big role with that. And when your mitochondria, which are your powerhouses of your cells, are tired, are stressed, are dealing with the burden of these toxins and these poor fats, then that's going to impact how your cells create energy, how your body balances your hormones. Yeah, I already talked about the endocrine disruptors and the pesticides and the herbicides. Hormone replacement and birth control. There's a really great book called Beyond the Pill by Dr. Jolene Brightman. I highly recommend that if you're doing any kind of hormone replacement or taking birth control, that you read that book. It really goes into all the details of the long-term impacts of that artificial support of hormones in the body, and just what that masks, in terms of all these reasons why the body is having hormone imbalance issues to begin with, and the long-term side effects that can come from that. I also wanted to just throw in here a little bit about the thyroid and gallbladder connection, because I see this so much with women in my practice, that they have a long history of hormone imbalance. They have a long history of toxicity exposure, and then somewhere along there, they lost their gallbladder, right? And so the way I see it is that the hormone imbalance, long-term then impacted the thyroid function. They have underacting thyroid, which then correlates to poor gallbladder functioning and stressed liver flow and bile flow from the liver due to the toxicity exposure, which then causes the formation of gallstones. And so then, people end up losing their gallbladder. It permanently compromises their ability to digest and absorb fat. and their liver has to work harder to produce the amount of bile that's needed, not only to digest fat, but to clear excess hormones out of the body. Right, but let's also talk a bit about mold. This is something that I'm just seeing more and more, particularly with some of my clients that are dealing with more chronic hormone imbalances and really stubborn weight gain. Mycotoxins, that are the toxins within mold, disrupt hormones. And it causes so much imbalance in the body. But people with exposure to mold, whether you're currently living in it, right, and you might not know that you are, unfortunately, but if you've ever had water damage in your home, they haven't had checked out, or you have an actively wet basement, there very likely could be mold, or it could be a previous exposure, right? Something that you lived in the past, or a known exposure in the past, but the body can store these mycotoxins. It can store it in fatty tissue in your body. So mold exposure can lead to chronic fatigue, cognitive and mood disorders, but also many disruptions in hormones, severe PMS, infertility, early menopause, erectile dysfunction, night sweats, heavy periods, extreme fatigue, thyroid dysfunction, including Hashimoto's, diabetes, and unexplained rapid weight gain or loss. I definitely find it's one of the more hidden missing pieces that we can identify with the work I do with nutrition response testing. And when we land on it, it's a big project, but it makes such a difference when we can get these stores of mycotoxins cleaned out of the body. So I wanted to speak more specifically to menopause, just to make sure, because it's such a critical part in women's lives that we don't get educated about the same way we get educated about puberty. And I end up working with so many women who are experiencing these symptoms from it, or end up finding their way to me because perimenopause has just thrown their body is such a loop, and they don't understand their body anymore. So this one information is taken from Dr. Pell's, because it's just such a misunderstood time in women's lives. So as women approach midlife, sex hormone production slowly begins to decline over the course of 10 to 15 years, and this is known as menopause. So during this process, the ovaries hand over the job of making sex hormones of progesterone, estrogen, and testosterone to the adrenal glands. So the adrenal glands are these tiny little glands that live on top of our kidneys and are also responsible for our cortisol production, our other stress hormone production, for blood pressure and blood sugar management. They do so much. And so, as Dr. Pell says, if you are like most women I know, your adrenals might be already taxed with everyday stress, family and work obligations, etc. So that decline in estrogen that starts happening, and the inability of the adrenals to really take on the task because they're already overwhelmed, has a shift towards insulin resistance. So for many women, the weight loss habits or maintenance of weight that worked for them in their 30s suddenly falls short. And then another big thing that women notice during the menopause is the effects of the loss of testosterone and progesterone. So this often looks like irritability, anxiety, poor sleep, low libido, low motivation, and inability to put on muscle. So what it all comes back to is requires giving additional support to the adrenal glands in the form of stress producing activities and adrenal support supplements. So some things you can do, and I find that these help whether you're menopausal or not, but they are such great tools, and particularly if you're struggling with menopausal stages, is number one, stop eating all day long. Okay? Only certain types of bodies and certain imbalances in the body involve like 3 meals a day and 2 snacks, right? Or like just eating every couple of hours. Adopting a fasting lifestyle can have dramatic effects on relieving menopausal symptoms. And so step number one can be just going to 3 set meals a day, and stop snacking. Number two, vary your eating style and foods. So while I definitely advocate that people have an eating style that's low sugar, overall carbohydrates from vegetables, a little bit of fruit. So it's more in the direction of what's known as the ketogenic diet, or really a healthy ketogenic diet. Lots of veggies, good quality fats, good quality proteins. You want to not be stuck in one thing, right? You want to change the way you eat to keep the body adapting. And that can even involve eating different ways at different times of your cycle. And I think Dr. Pelz's book is really great about describing more of that too. And then number three, build a, what she calls a bulletproof microbiome. So you need strong gut flora to efficiently break down and use the estrogen that you have. And especially going through menopause, you have so much less estrogen. So you need to be efficiently breaking it down and using what you have. And this is where the detoxing the body is such a key role, because the microbiome will not be strong, will not be in balance if you're dealing with a chronic toxic load. And so you have to find the correct way for you to clear those toxicities out, and then use that as a way to repopulate with the good, right? And that's where, whether that's taking certain probiotics or eating certain probiotic rich foods. But let's talk a few more tools to balance female hormones. Number one, just know what's going on, right? Be informed and track your cycle, right? It's so great to know what's actually going on for you, and you can see patterns and just be more in tune with your body. Number two, as I was just speaking about, like if you're not already, try a ketogenic and a fasting lifestyle. So a healthy keto diet can help normalize cortisol, support your adrenal glands, improve your natural progesterone levels. It's not for everyone. That's why I recommend, working with a professional about it. But it can be a game changer for many women with hormonal imbalances, hormonal related symptoms, really feeling stuck postmenopausal, especially with weight gain. I'm educated in keto diet, and I guide my clients towards it or on it. But we also at our office have a keto specialist, Ryan Kimball, who does a customized keto program where he really gets into detail with it in the terms of really making sure that you're in ketosis, and helping to understand what that means for your body and what you need to do to get there. So we were just talking about take care of your gut health. So when gut health isn't optimal, your hormones are imbalanced. This is the foundation of the work that I do. I really find it's a initial step that I do with people is usually detoxification and microbiome rebalancing. So lowering your sugar intake is key, right? Not only for avoiding obesity, diabetes, other diseases, it's just key for hormone function. It's key for changing around insulin resistance, key for microbiome balancing, and allowing the body to optimize how it produces hormones. And as I mentioned early, whatever stress reduction techniques work for you, it is key as well, because of this whole cortisol component, right? So cortisol is the stress hormone that helps your body cope with long-term stress. It's not meant to be like our modern lives where it's being produced all the time, because there's always stressors or always things that our body perceives as stress. But the modern busy rushing lives that we live, particularly as women, particularly so many of us as working women and mothers, our body's response to stress activates a cascade of events that lead to cortisol production. But we just have all these feedback mechanisms with chronic stress that we just don't get out of the cycle, right? And that impacts our adrenals, it impacts our thyroid, and it just creates such a cascade of imbalances. So one of the most important things, and something that I am actively working on doing, is learning how to stop rushing and how to slow down and really to work. It's just not just a passing phrase, oh, that's self-care, but to really work in those times to stop and have deliberate time for oneself, to pull you out of that cortisol dominance so that your hormones can balance themselves. I mentioned this earlier when I talked about the clean 15 and the dirty dozen, but genetically modified foods plays a big component too, because that dairy, meat, pork that come from cows and pigs treated with hormones and genetically modified foods can cause hormone imbalances. Long-term ingestion of GMO foods that are sprayed with pesticides can cause hormonal issues that have been linked to depression, infertility, polycystic ovarian syndrome, and cancer. So very quickly, you start to pull out the GMO foods and put in more organic foods. It can play a big role in quickly decreasing the body's toxic load, which helps the liver, helps the microbiome, helps hormone balance. Avoiding soy helps hormone imbalance. So soy consumption is linked to thyroid issues such as hypothyroidism, goiters, autoimmune thyroid disease. If unfermented, soy has anti-nutrients that block the absorption of calcium, magnesium, iron, and zinc. So eating as little as 2 tablespoons of soybeans per day for a month can really throw off thyroid stimulating hormone. So if you're going to consume soy, I recommend consuming fermented soy such as miso or tempeh, and in small amounts. Eating more liver helps balance hormones. Liver is the most nutrient-dense food you can eat. It helps to curb PMS and mood swings. It can increase your energy and improve your heart stamina. A lot of people find it unthinkable to consume liver every day. I like to do it in the form of pâtés. I think they're delicious, but you can also take liver in supplement form, and you can get the same benefits. Fish oils for hormones. Omega-3 fatty acids are needed for hormonal balance because they're used in hormone production and function. So our body needs these essential building blocks to prevent hormone conditions. And many people just don't get enough of these through diet. They don't eat enough fish. Omega-3 fatty acids are also found in chia seeds and in flax seeds and in walnuts, but it has to go through more conversions than when you just eat straight up fish. And so high quality fish oil supplementation can make a huge difference. And some more of my favorite female hormone support supplements. So there's Ladies Mantle Tea. Ladies Mantle Tea can help with really heavy periods or excessive bleeding. And if you're having trouble actually having a cycle, it can then help to bring on your cycle. If your progesterone's low, right, you're missing cycles, things like that. Vitex berry you can have as a tea, or I use this in pill form and supplement form, called chasteberry. I use it with irregular or painful periods, breast pain before the period, infertility, other PMS symptoms. Use it during menopause or when people are coming off of birth control and trying to rebalance hormones. It's really just, I would consider, woman's herb. Women can be on it all parts of their life because it helps to normalize when things are too high and things are too low with sex hormones. We were just talking about omega-3 fatty acids. One of my favorite go-tos is this one from Standard Process. Find it's great for supporting sleep, supporting emotional balance, brain development, great for growing children. Just all across the board to balance omega-3 fatty acids in the body. Simplex F, another favorite of mine, and the one that I'm going to raffle off at the end of today for those of you who have joined me in person. It's a standard process whole food supplement that supports healthy function of ovaries, adrenals, pituitary, and thyroid glands. It's, again, I think of it as like a woman's multi in many ways, because it just supports on all different aspects of life and stages of hormone balance, optimizing that balance. A newer product that's quickly becoming a favorite of mine is Estro from Cellcore. It's a blend of adaptogenic herbs. Adaptogens are herbs that help support the body's resiliency and adaptability to stress, and are great used long term. So this contains ashwagandha root, astragalus root, maca root, messin pine pollen, and turmeric. So it supports healthy estrogen and testosterone levels in both men and women, and can be taken at any life stage and help encourage overall wellness and longevity. And it promotes the balancing of the hormonal system. So it supports, bone density and fertility and healthy libido, healthy metabolism, improved digestion, mood support, normal adrenal response, and skin health. What I find, as I've been talking throughout this whole talk, and I mentioned first thing, the tool of nutrition response testing is key to get to the root cause of why you're dealing with hormonal balances in the first place, right? It's a non-invasive system to assist me as the practitioner or any nutrition response testing practitioner to understand why the body's out of balance, why you're dealing with ill health. I look at a lot of different reflexes and ask the body a bunch of different questions and get to the priorities of typically, what toxicities are causing your system to be so disrupted. But toxicities are one of the biggest, but we look at microbiome imbalances. We look at all sorts of reasons why there are barriers to healing. And if this is not part of your current healthcare support, I highly, highly recommend that you have an assessment so you can see how it can benefit you. I spoke a lot today about how much toxicities impact hormonal health. And I see the Ion Cleanse Detox Foot Bath as an amazing tool to accelerate the detoxification process and gently support it, and help the body start to get on top of it. And it's easy, it's relaxing. We talk about that self-care and bringing down cortisol time, and you sit for 30 minutes with your feet in warm water and just relax as the ionization in the water activates the toxicities that are particularly stored in fat cells and starts facilitating them moving out of the body. It can be a great tool for kids at any age. And you're recommended to do as many foot baths as you are years old, and ideally doing it on a 2 to 3 foot baths a week basis for focused periods of time, like say 2 weeks at a time, and seeing how your body responds. And another wonderful tool that we have at the office as well is pulsed electromagnetic field therapy. You can think of this as a battery tune-up for your body. Your batteries being your mitochondria, right? Your cell's powerhouse. And it's another very relaxing treatment. I call it a 30-minute power nap. You lie down on the mat that we have upstairs in our quiet little reset room, and the mat gives off different low-grade electromagnetic field frequencies. I often start people on the frequency that matches the frequency of the earth, and it's very grounding. But we see quick results of people dealing with chronic pain because it increases microcirculation within the body. It can help to improve sleep cycles. For sure, it can help with faster healing of soft tissue. We've had athletes with injuries do regular PEMF treatments and heal a lot faster. It reduces inflammation overall in the body, and it can, when done in conjunction with the foot bath, they really magnify each other's benefits. So I hope you learned a lot today to empower you more about your hormones and what you can do to have them be healthier and you for overall happier. Um, Start your journey with it today, and give us a call or reach out if we can be any help as a support in this journey for you.